In this video we are going to learn about investigation and treatment modalities of stable angina using a mnemonic S angina. S symptom assessment: evaluate the patient's symptoms, including the nature, severity, duration, and precipitating factors of the chest pain. Assess for associated symptoms such as dyspnea, fatigue, or lightheadedness. Assessment of ECG electrocardiogram: perform an ECG to assess for ST segment changes, T-wave abnormalities, or evidence of previous myocardial infarction. Resting ECG may be normal in stable angina, so an exercise stress test or ambulatory ECG monitoring, Holter monitoring, can be considered to capture symptoms. Non-invasive tests: consider non-invasive tests like exercise stress testing, for example, treadmill exercise test, or pharmacological stress testing, for example, stress echocardiography, nuclear imaging with myocardial perfusion scan, to detect and evaluate the extent of coronary artery disease. Guidelines: follow evidence-based guidelines for the management of stable angina. These guidelines provide recommendations on investigations and treatment strategies based on the patient's risk profile and symptom severity. Invasive angiography: invasive coronary angiography may be performed to visualize the coronary arteries and identify the presence of a significant coronary artery disease. This procedure allows for potential interventions such as percutaneous coronary intervention, PCI, or coronary artery bypass grafting, CABG. Nitrates such as sublingual glycerol trinitrate, can be used for immediate relief of angina symptoms. Long-acting nitrates, for example, oral or transdermal preparations, may be prescribed for prophylactic management of stable angina. Antiplatelet and antithrombotic therapy: antiplatelet medications, particularly aspirin, are commonly prescribed to reduce the risk of thrombotic events in patients with stable angina. Other antithrombotic agents, such as clopidogrel or dual antiplatelet therapy, may be considered based on the individual's risk profile. In addition to the S angina mnemonic, other treatment modalities are lifestyle modifications, such as smoking cessation, exercise, and dietary changes, statin therapy for lipid management, beta blockers to reduce heart rate and myocardial oxygen demand, and calcium channel blockers or long-acting nitrates for symptom control. That's all for today. Thanks for watching. What should we cover next?